Hi, my name is Brittany Insana. I'm a registered occupational therapist at the Washington Health System, Washington Hospital. So occupational therapy is helping individuals return to their prior level of function by promoting the most independence we can. We look at their daily occupations, and that is what everybody does from day to day. So that can be dressing, bathing, cooking, cleaning, if returning to their job, or for a child, it could be something like play. And so our ultimate goal is to improve quality of life and promote independence. The main difference is, as I like to tell all my patients, physical therapy looks at strength, conditioning, endurance, and us as OTs like to take those gains and we like to make them functional. And so we like to work on functional tasks, whether it's transfers, whether it's getting on and off the toilet, going in and out of the bathtub, getting dressed. And we do look at client factors such as balance and strength, and if we need to address those things, we work on them. But we try to look at functional tasks and promote independence in those, whether adapting things or modifying things, or giving them tools or suggestions, where PT focuses a lot on those client factors such as solely strength, endurance, balance, all of that. OT also does look at things like fine motor skills, visual perceptual skills, cognitive skills, and how all of those components may also affect their overall function. So all our goals are very dependent on our patient. And so most examples are daily things like dressing, cooking, cleaning, home management. We can even work on cognitive tasks such as medication management, home safety. And we do a lot of those things in their acute care room so that, they can build their endurance and do all of those things. And then as they get stronger, we can bring them down to our OT apartment where we're actually sitting at here. And that includes a car, so they can practice that, as that is something that they get into immediately post-discharge. We have a little grocery store that they can practice if that's something they do. We have a golf course just to work on some leisure activities. And then we do have a kitchen set up and a bathroom set up so that they can work on functional transfers and, cooking tasks. So we individualize all our stuff, but those are some examples. We like to joke that everyone can benefit from therapy. It's great for everyone to move. It's great for everyone to get up and get stronger and get back to going back to their daily life. We focus our therapy on whatever is important to them at the time. And so that varies depending on if we're working with someone from birth to end of life. We address all of those things, and so it just depends on why they're here. They could be here due to a disease process that they were born with, something that they just acquired, a trauma, a surgery, or it can just be something as they age. We do work with joints here, elective joints, and so we try to get them stronger post-surgery. People with congestive heart failure who might just be decreased endurance, decreased balance, decreased strength, and they need to, just build that all up to get back to home. Or, we can work with our kiddos to just help develop play skills, and so that they can develop and become active adults, and just, play with their peers. We try to focus and be client-centered with them, try to address their personal goals, and get their independence optimized prior to going home. Washington Health Systems offers both inpatient and outpatient occupational therapy. We also offer outpatient pediatric occupational therapy services at WHS Children's Therapy Center. For more information about our occupational therapy services, go to whs.org.